Hopefully you've got yourselves a cup of tea, or some lunch. Jennifer, I can see you're just concentrating, working hard as usual. Good to see you. I know.
Jen's
Dedication on
working
the
very
screen
hard.
ahead.
Yeah.
Nice. Just gone.
And Blair, hi Blair. Thanks for joining us.
I still love this romper room idea where we just reach out and say hello to people. Oh, and there's Austin. Hi, Austin. How are you?
Hello.
All right, it's 1:02. I reckon we get kick-started because if I know Zoe, I know that there's a few slides to get through. Haha, Zoe. Anyway, so welcome to webinar 2, mandatory. Whoa, go back. I'm going to announce the title.
Sorry,
Thank you.
Michelle.
Mandatory training, best practices to plan, implement, and evaluate staff training. We're in a series at the moment, and this is webinar 2. Click. It is my pleasure to acknowledge, for Zoe's sake, the Wurundjeri, I haven't got the second one, Woiwurrung people, as traditional owners of the land that she's on today. For me, I'm on Wongal land where I play and work. I'd like to pay my respects to those elders, past, present, and emerging from both of the countries that we're standing on today, and acknowledge the enduring impact that they have on our learning practices. So I'm going to intro Zoe. You can see the short version on the screen, and then I got the long version, and then I thought, stuff that. I'm going to just adjust it, play with it a little bit, because I can't help myself. So allow me to introduce Zoe Yule, a critical care RN and AusMed's go-to guru on all things CPD and healthcare education. For over 10 years, Zoe has been shaping the standards of nursing from the ICU to international projects. She's even managed to squeeze in a master's thesis on CPD impact along the way. Currently, she's the director of AusMed's acclaimed provider unit, the only Aussie team accredited with distinction by the ANCC for 4 straight cycles. Zoe's expertise spans clinical governance, risk, and compliance, all while championing best practices in healthcare education. Basically, if it's about learning and nursing, Zoe's the one with the answers. Take it away, Zoe.
Oh, I love it. Thank you, Michelle. Thank you very much. I might have to get you to email me that bio, and I might pop that on my LinkedIn and update things. That's very, very kind of you. And thank you all for joining us today. It's a privilege to have your time for the next 55 minutes, and I hope to use it wisely because we all know it's precious. So what are we covering today in this webinar? We're going to look at 4 aspects. So our objectives today, 1, we're going to look at the role of mandatory training. Objective 2, review some of the challenges, there are some apparently, of mandatory training. Focus on best practices for planning, implementing, and evaluating. So we're going to look at how we do it well, and we'll end with a funny but serious funny section where we're going to look at busting some mandatory training myths. I do want to stress, though, that this is the basics. So this is what's been advertised, but full disclosure, we're looking at reviewing the fundamentals of mandatory training. So for many of you, it might be existing knowledge that is going to be reinforced today. Hopefully there'll be a few new gems, a couple of new ways of doing things or thinking about things that you can take and apply to your practice. But I do want to stress it is the basics. And in our next couple of webinars, which will pop the registration link up towards the end, is where we're going to be really stepping towards that new thinking, new way of doing things and stretching you. But today's hopefully a really good basics review. So let's get started. Well, what is mandatory training? So it's compulsory training that an organisation requires its employees to complete, and it's a condition of their employment. So we typically see that the workplace, so your organisation, the employer prescribes the mandatory training, but it should differ according to the function and the staff groups, the disciplines and the role. So it shouldn't be, this is one set of training that is prescribed for everyone. It needs to differentiate according to the role. It's there to support staff, really, to undertake their roles safely and effectively. A good definition from New South Wales Health states that mandatory training keeps the workforce safe. But we're really looking to use mandatory training to support and improve compliance, minimise risk, and then support quality of care. So that's our general working definition. Why is it needed? Well, just want to rewind a little bit before we look at why mandatory training as such is needed, and look at why something like standardization within the workplace, particularly within healthcare, is critical. So in healthcare, we need to do something in a consistent way each time, every time, because organizations, when we're caring for people, we need to have trust and develop consistent processes and procedures. And that's what gives us our efficiency, our safety, compatibility. We know most healthcare systems, aged care systems, are across multiple facilities and sites. And in particular, because of the clinical nature of health and aged care, we need consistency to reduce clinical variation, because we know clinical variation leads to risk, which leads to harm, and that's what we want to prevent. So if we take that standardization concept, it's pretty clear that we need standardized training. So standardized mandatory training is therefore needed for these three areas: for compliance, so that staff can comply with the relevant laws, the regulations, the industry standards that are applicable to our context of practice. We also need standardized mandatory training for safety. We're trying to train everyone to a consistent standard to minimize the risk and reduce the incidence of workplace accidents and injuries. And we're also trying to improve quality of care. So we're trying to support staff through this vehicle to build the necessary skills and knowledge that they need to perform their role effectively. So we do know that there are actually some benefits to mandatory training. When we implement it effectively and with engagement, mandatory training programs can offer benefits to the organisation and the workplace, and also to the consumers, the patients, the people receiving care from us. So for an organisation, the benefits can include the risk mitigation, compliance with the required standards, standardisation, quality assurance, and that reduced risk of incidents and injuries. And again, when done well, the staff or the learner benefits can include improved job performance and awareness of the relevant regulations to assist in avoiding those potential, non-compliance and legal consequences. As learners, we get an awareness of safety, awareness of workplace accidents and injuries, look at, how we can prevent them, and of course, that understanding of organisational policies and procedures. So there are a number of benefits to effective mandatory training. I'll just briefly define a couple of key terms so that we can see mandatory training as it should be within the context of other types of learning. So mandatory training sits as a form of compliance training, and this refers to any compulsory training that an organisation prescribes that will affect a compliance rate. And of course, we see induction and mandatory training here. We've then got optional or recommended or suggested training, and this differs because learners can choose to complete it or not, and it won't affect an organisation's compliance rate. And then we have CPD, or continuing professional development. And that's a formal requirement for registered health professionals. So a registered nurse or an enrolled nurse, a registered midwife need to complete a recommended minimum amount of CPD annually. It's calculated in hours. For myself, for Michelle, the other nurses, it's a minimum of 20 hours, and it's a registration requirement. So every year at renewal of registration, we have to declare that we've met that requirement. So you can see mandatory training is just one type of compliance training, but there are many, many other learning streams and learning activities that an individual and an organisation will prescribe. So, does mandatory training count as CPD? Can I use mandatory training as part of those 20 hours? Only if I can only do that if I can provide evidence that mandatory training meets an identified need and contains new learning. So the same manual handling mandatory training module that I do in 2024, 2025, 2026 that contains no new learning and doesn't align with identified goals for my practice cannot be considered CPD. So we need evidence that it meets a learning need and contains new learning. That's our criteria per the regulation for mandatory training being documented as CPD. So speaking of regulations, we're on this quest to understanding, identifying what mandatory training is needed. We have to start with what our rules are. What's the regulatory requirements? So for anything, we need to start with the workplace laws. And of course, that's the Fair Work Commission, the Fair Work Ombudsman, that states, any employer must know the responsibilities under the 2009 Fair Work Act. So we've got the 10 national employment standards. We've got, a very prescriptive set of arrangements around awards, agreements, wages, discrimination. But the key thing is for us all to just remember, in the context of mandatory training, that as an employer, we are responsible for providing a healthy and safe working environment. So that's the basis for where a lot of these mandatory training modules or topics will come from. That safe and healthy working environment. Fair Work are very clear that time spent training is time worked. So for employees, training as part of that job, that is paid time. So very important to just acknowledge, as you would all know, that's the set of arrangements that we have in place. Looking a bit further into the healthcare standards, we have legislation that mandates the need for adequate training. So our national standards will outline in a number of different places. You're seeing just a snapshot here, the importance of training and supervision. So within the NSQHS standards, we have Action 1.20, and it's very specific about what an acute care organisation will need to provide. Same within the NDIS practice standards, providers must have a system in place to identify, plan, facilitate, record and evaluate worker training. And of course, we've got Outcome 2.9 within the strengthened aged care quality standards that state and prescribe the need for not just training, but a training system.
Zoe,
yes,
I'm
Michelle.
you. There's a hand up.
I think sorry, I'm not looking at my
That's all right.
screen. Angie, go for it.
Hi, sorry to interrupt.
You
I just
never
had a quick
apologize
question.
for asking a question.
Thank you. When you mentioned that all training is paid training, I just wanted to know how you had said that there's mandatory and optional. Even for optional training, let's say we have a catalog system where we are obviously assigning our employees to do some mandatory training, that's all paid. But if it's optional, when they go and select out of their own will a few other courses they would like to do, same for OSMED, but does that come under the same umbrella that we need to pay them for that, or only mandatory training?
Look, excellent question. Really, really, really good question. It may depend on your organisation's policy and procedure. Michelle, did you want to jump in? We see a lot of different arrangements that might be in place. Michelle's probably best to jump in and see what's most common.
Yeah, I think it in my experience, it depends on what you've got in your policy, also what you've got in your EA that's declaring something as mandatory. If any of your communications to your employee has implied or stated that they must complete a learning piece for their employment or for advised advancement in their employment, then you must pay them for that. If you have said to them, and here's kind of a case use case, if you've said to, and I'll use an aged care example, apologies, but a care worker that, if you'd like to progress and get up to team leader, this is the suite of learning that I would expect you to do. I'm putting it in your assignments, but it's up to you when and how you complete it. Then that doesn't have to be paid. They're doing it for career advancement opportunities that they don't have to do, but you're laying out a learning path in front of them. Even once they achieve that team leader status, because of what they've done, you don't need to reimburse them for the learning they did to achieve that. The same as a professional might go off and complete a degree or a master's. You don't then pay them for the time that they took to do that master's to achieve that position. So I think for me, the answer is make sure you're clear in your documentation about what you're asking them to do. And it would be expected that anything that came under, if you're using the AusMed platform, anything that came under mandatory training plan, even a mandatory non-compliance training plan, would be learning that was paid. And in my experience, the unions will follow that one up as well.
Thanks, Michelle. Brilliant. And for those that have the registered, large in hospitals, large population of registered nurses, the CPD requirements state very, very specifically that it's the individual's obligation and the individual's requirement to complete CPD. So again, those same principles will apply. Great question, and feel free, anyone, to pop your hand up. Michelle, if I don't catch it, thanks for interrupting me. Feel free to ask away. I'm going to now, I think it's a good time to just state or reconfirm, what are the objectives of mandatory training? So when we are, of course, paying for staff time to undertake learning, we really need to think about, what are the clear learning objectives that we should focus on so that we can make that time spent learning most valuable for all parties involved. So they really should focus on 3 key areas: compliance awareness, so knowing the relevant legislation and standards; risk mitigation, think safety; and then providing quality person-centered care. So from a compliance perspective, we really want, and a learning objective would be around knowledge, that staff have the basic knowledge about the relevant legislation, the quality standards, and other requirements critical to their role. With regards to risk, we'd want to be looking at objectives that help staff identify and manage potential risks, or at least know how to raise that issue to the appropriate person and be able to contribute to that overall workplace safety. And then when we think about quality of care, that there's a number of topics that would be relevant. But we'd want to see objectives that really support someone to improve the care, the service provision specific to their role, to ensure that we're meeting the desired standards. If a module sits outside of these objectives, I think very, very carefully about if it should be mandatory or not. So like induction training in our previous webinar, though, there's no magic list. There's no list that any of us can find that will state exactly what mandatory training we need to provide. So we have to think with those very clear objectives in mind around compliance, risk mitigation, and quality of care. What do we want the learner to know or be able to do as a result of undertaking that mandatory training? And these are typically the training modules that we recommend and that we see providers using. I'm going to keep flicking through, but you will get access to these slides, and of course the recording that'll be sent out in the next 24 hours. So you will get access to this list. Of course, we've within the AusMed library, these modules that sit across those 3 key objectives: compliance awareness, risk mitigation, and clinical care, are available. But I just want to pose the question, does this equip staff with all of the knowledge, the skills, the competencies they need to perform their roles effectively and safely? The answer is no. Most organisations will complement mandatory training with additional learning and professional development opportunities in order to provide that safe and effective care. Okay, moving through to our second objective, I'm going to now look at the challenges of mandatory training. So we've defined it, we've looked at the role, we've looked at what it should focus on, but we all know that there are challenges to actually undertaking and seeing an effective mandatory training program. So it presents several challenges, let's be honest: time, cost, poor engagement, training fatigue, excessive requirements. We see some long lists sometimes, poor compliance, a lack of focus on outcomes, which I'm keen to dig into shortly, and measuring effectiveness. So when it comes to time, we know that time constraints can limit the effectiveness of mandatory training. We, as a provider, know that we have to fit the relevant content into an allocated training budget. And of course, we know that this can mean that learners will rush through completing it. In terms of cost, as Michelle and I've mentioned, paid training time is a big cost for organisations, but organisations they also have the cost to develop and maintain that content. We can see low engagement due to, the need to repeatedly undertake the same content, which can sometimes undermine the actual objective of what we're trying to achieve. And when it comes to overloading staff with modules, we know that can mean that organizations, we may not be setting a clear focus for what's actual critical learning. And as providers, as L&D teams, we can be unsure about, given all of the requirements and needs, what actually is core? What should we be including in a training program? Moving on, we've got training fatigue, we've got poor compliance. We know that for you as managers within an education or a people and culture team, a lot of your time is wasted when you've got to chase up and get people to complete their mandatory training. I think we honestly, I'm going to call out, we have this long-term fixation, I might say, on measuring the success of mandatory training as time spent learning or completion. We're not focusing on what are the actual outcomes of mandatory training and are we achieving it? Are we seeing a change in practice? Are we seeing an improvement in quality or safety? And I think, there lies the challenge for us, that assessing the impact of mandatory training is a really, really big challenge. And that really does hinge on having accurate reporting, but also being able to clearly say, what does success of mandatory training look like? So, one way to reduce some of that training fatigue, at least for new starters, is to recognise prior learning. We do that with the AusMed Passport. But we need to think about what the challenges what's the impact of these challenges? I won't spend too much time on this because I know many of you will experience them. They're very real. But we know that rushing through learning may not mean that someone adequately undertakes and actually engages with that learning. Cost, it's a big investment. And because that there's paid learning, there is an emphasis and even an expectation by the payer or the organisation that time must be spent well. That every second of paid time has to be tracked. It has to be measured. So when a learner's disengaging or fast forwarding, forward scrubbing, whatever you want to refer to it during a module, that what that's doing, because it's paid learning, is that we're almost creating a relationship, but where there's a lack of trust between that learner and the provider. When it comes to poor engagement, we know that it's not going to be retained. If you think of your own experience with mandatory training or any learning, if it's not sinking in here, good luck in a week trying to actually apply, what's been in front of you. So to compound the cost, the time, the engagement challenges, we make people do a lot of training. We've got lots of requirements, and the list continues. From there, we're almost spiraling. We've got training fatigue. We're creating, a passive learning environment where we're reducing the effectiveness of learning, which is impacting our compliance rate because the training isn't get done, or at least not on time. And so we've got ourselves in a bit of a pickle. As I've mentioned, I think that the two challenges that we like to focus on here at AusMed is, of course, creating really the most engaging content that we can, supporting you to understand what's important, what should be mandatory, what's maybe not necessary, but on these two aspects, and look at how we can help get really clear on the outcomes of mandatory training and support you to measure, what effectiveness of mandatory training is and how we can measure it. So I've got a really funny video. I'm hoping all my sound and everything works well. It's of Donna Wright. Some of you may have seen some of her resources on AusMed. You might have her book. I'd say she's a mandatory training and kind of competency guru. She's hilarious. And this little snippet was recorded at an AusMed conference a couple of years ago now, but I honestly think she sums it up. Little disclaimer, she's American. So when she says competency, she probably was referring to mandatories in the same way. So they use those terms interchangeably, but it'll play for us now.
I want to be clear about something. I really, with competency assessment, I struggle with the fact that competencies come from the top down in an organization. And even add anything from governmental regulations or things like that too. That's the same kind of concept. The whole idea of we have to do a mandatory something, mandatory this, mandatory that. You know, and we have piles and piles of regulatory things, mandatory modules, required competencies. There's all kinds of names for this stuff. And we have it coming from the top down. And I don't know, but you know, I've seen people have 30, 40, 50, 200 competency things. And we're checking them off, checking them off. Got to do my competency stuff every year. It's crazy. It's absolutely crazy. And it's not necessarily making us smarter or better. And that's what concerns me. I had a group that looked at this in Chicago, big hospital system. They calculated for in their hospital system, they had 4 hospitals, they were spending $1.2 million on training every year for mandatory modules, $1.2 million. So they decided to go around and ask employees questions about that for any module that they had for 3 years or more. You should know that information now. If you've done it for 3 years in a row, we want to ask you some questions about stuff. So they asked them questions. Less than 2% of the information was retained. So you're spending $1.2 million for a less than 2% return rate? That's crazy.
Clear. Pretty tough, right? She sums it up well. Does anyone think about that, the cost and the outcomes in your organisation? So good news, we can address this and I think we can do a little better. So we're going to try and move into some of that solution mode, and we're going to look at a few practical and theoretical components that will help make mandatory training effective following that best practice cycle, and then bust some of those myths that we know also holding the effectiveness back a little bit. So, you know, really simply, we can follow a best practice cycle of planning, implementing, and evaluating, which is best practice. So 3 phases, and we're going to go through each of the phases now. So within the planning phase, which I know you're all undertaking in the thick of now, these are our core best practice strategies. So we need to conduct at a minimum an annual needs assessment or training needs analysis. What we're doing here is we're trying to identify and then validate the need for any item in a training plan. We need to use data, and we have to think about what is the desired learning outcome of mandatory training as a program at its whole, and then for each module. We need to be thinking, you know, is this module meeting one of these core objectives around compliance, risk, or quality of care? And as I've said, if it's not meeting one of those, then ask yourself why you're including it. Is it there because it's always been there? Have we always included this module and we can't part with that? We have to include that. Does it still need to be? Or is it there because someone wants it? What we're trying to understand is, you know, have a conversation. If someone has said we need this module in our mandatory training program or mandatory training plan, find out why. What's their rationale? Do they have data about why we need to make it compulsory? You know, doing this means that we can, at least on an annual basis, assess if there are any new inputs into a mandatory training plan. We need to be thinking, has a regulation change? Has evidence-based practice changed? You know, what are the new risks within an organization's quality or safety system? You know, has there been something new that's changed? We're, of course, reviewing job roles and target audience. We need to understand very clearly who are our learner cohorts, have their needs, have their names of the job roles changed, has their scope changed? You know, is there a particular job role of a particular type of care worker, a homemaker, for instance, that previously wasn't, serving meals, but now they are. If that job role has changed or that scope in the role has changed, then their mandatory training plan needs likely to be updated as well. So to think about, you know, what actual mandatory training is needed, we can and we need to go to sources of data. And the fact is that there is so much data, so many sources available to us that we can actually use to validate. So we're trying to engage with this data to validate actual needs, not wants, not likes, not desires, you know, not security blankets that we're holding on to that may not be relevant. We're trying to think about, you know, do we have data to actually validate what training and education we need? So as you can see on the screen, there's a lot of it. We've broken it up here into consumer data, nursing or clinical staff data, and other sources. So, just picking out a couple, what do your consumers, what do your patients or clients think? What do they see as red flags or issues that are important to them? Engaging with this group, honestly, as a target audience in our annual needs assessment is best practice. So if you're not at least speaking to your consumers, the people in your care, just to get a pulse check on what training is needed, then it's best practice to do so. Also thinking about what does management and leadership have concerns with? Are there red flags on their radar that we actually need to take an input into our training plans? If you're getting them reviewed, that feedback might come to you, but be proactive, go out and engage with all of the key stakeholders to understand, what's new this year that I need to put in. Trust your gut, your experience, what you know. Think of Donna Wright. We've had this in for 3 years. I'm really not seeing any change in practice, with this particular topic. Validate the instincts that you have, but back yourself as well. As we shared in the induction training, it can be also really helpful to look at benchmarking data. So if you remember from that first webinar, benchmarking is the basis for benchmarking is to implement best practices, but at best cost. So you can take a look here. We've got on the left the average number of resources in a mandatory training plan and the average number of duration of those plans across the key sectors. So have a think about, how does your training plans, how does your structure, does it align with what you're seeing here? Have you got a similar amount of resources that's common for your sector? Or, are you way out? Are you way under? Just understanding a little bit about what other providers do can help, really validate that you're on the right track. So within phase 1 planning, we've got, the really critical aspect of scheduling. I guess our number one tip is to stagger it. Staggered learning is simple. It's just spreading it out, spreading out the delivery of training over time rather than trying to cram all the content into the first few days, weeks, months, whatever it is. So given that, you've got many different approaches to scheduling depending on the type of system that you're using. We've got recurring training. That's obviously what's most common, that ongoing mandatory training completed annually. Maybe you've got planned and once off. So induction's a good example of that. What a new starter will be required to do. But you've also got just-in-time training. Think about, even if you've got your plan set up for the year, that just-in-time training is important. If in response to an incident, you assess that training or education can help mitigate that risk, then you may need to rapidly address that and assign that out as mandatory training. And as I've mentioned, other key steps in this planning phase are getting your training plans approved, and would really recommend, a touch point mid-year at least, just a quick review, either of your needs assessment or of your training plan, just to make sure that the planning that you did now is still in good shape and helping things progress nicely. To assist with your planning, we hope this helps. We've got a digital mandatory training guide. It's got some useful tips, tricks, some practical things that we're going through today, but also just a list of all of the mandatory training modules available at AusMed, and anyone that's registered, so you all here today, will get a copy of that. We've got that attached to the email when we send out the recording tomorrow. So we hope that helps. And of course, if you're with AusMed, make sure that you're reaching out to your customer success representative so that we can help you at this time of year if you need it. So moving on to phase 2, implementation, 3 key steps. Obviously, we're going to assign and deliver that training. We're going to hopefully optimize engagement and effectiveness, and then monitor for those red flags in compliance. So what helps promote engagement? We explored this quite extensively in a recent guide that you can see on the toolbox, and there are a number of things that can help engagement. I'm not going to say they're a silver bullet. There's a lot more to creating a good learning culture, that trust, measuring, and understanding what good outcomes are. But, there are some practical things. I'd say number one, make sure it's relevant. In this planning phase now, make sure that what training you're making mandatory for this particular job role is actually relevant training to that role. And, where possible, select content that has got these other features, like some scenarios, case studies, assessment questions. We know that these things can help to improve that engagement with with the learning. So as this training's being developed and delivered, ideally in that staggered manner, we of course want to monitor compliance. So red flags that can serve as maybe indicators that not only your compliance is low, but maybe that training module wasn't actually relevant to that job role, or it wasn't the most effectively designed item that we could have assigned. So, ideally, with Osmed you get this, but find a system that can give you this level of oversight, because that is going to help combat some of those challenges around engagement, around poor reporting that we do see. I know it's another QR code. We don't want to do death by QR codes on here, I promise, but I just wanted to flag with you that Michelle's running our final manager workshop for the year on the topic of compliance. So we're looking at going back to basics. It is just for organisational and team managers that are with Osmed. But it's highly practical. Michelle's amazing, as you can all see, and really want to support you to use the LMS as effectively as you can to manage that compliance. So it's on the 12th of November, so I think it's 2 Tuesdays from now. We are also doing the next webinar on compliance, a little bit more of a, I guess, unpacking it, rethinking it, examine some of those best practices, that holistic approach. But this very practical manager workshop is well worth registering for if you're with Osmed. And I wanted to draw your attention to this. You will have got a sense of Michelle. She is a thought leader in this space, and she's been doing a lot of writing for us. She's been very busy lately, and I wanted to draw your attention to a couple of her articles because they are stimulating. They will push your boundaries about how you're thinking about engagement, but other things, mandatory training. So we talk about forward scrubbing, that fast forwarding, flicking through mandatory trainings. We take an issue, we're very real about it. We pick it apart, and we really are trying to challenge those existing thinking patterns. So we're going to bust some of those myths shortly, but I encourage you to keep learning after today. Keep pushing your own thinking, challenge what maybe has always been done at your organisation that you've thought, I'm not so sure about the way that we do this. Here's some really good food for thought to have a look at. And of course, subscribe. I think this is probably the last QR code, don't worry. But if you sign up to the Toolbox newsletter, it's only once a week. It's every Tuesday, and we try and feature the most relevant items for your practice within that email. Okay, so back to our plan, implement, evaluate, best practice cycle. The final phase is obviously evaluation, but I want to break down evaluation into 2 key aspects. So we've got accurate reporting and evaluation, but starting with accurate reporting, it's about record keeping, of course. So we want, we know that typically mandatory training success will focus on measuring completion rates. And this is important. I'm not advocating for you not to do this. We know it's critical. We know that looking at completion is critical to understanding, to keeping track of your compliance with the regulatory standards. During an audit, we know that you need to be able to produce accurate and reliable records, but I'm just gently encouraging to look beyond reporting as the only aspect of evaluation that we need to do. Reporting on learning, having accurate records is critical, but there's a little more that we can be thinking about when it comes to evaluation. And this is because the essence of best practice organizational learning is demonstrating that training and education can lead to a positive outcome. So evaluation of learning is where we can really demonstrate not just the impact of the training module or the provider, but our impact as an L&D team on the broader organizational goals that are being achieved. And I really stress here that here's where that beautiful dance, that nice synchrony between education and quality initiatives, when working together, it really can improve care. We can reduce risk. We can get measurable cost savings for our organisation when we've got well-planned education, be it mandatory, optional, whatever, and quality initiatives. So unless we're evaluating, we're not going to undertake any of this knowledge. We're not going to get any of this information. So just pause and have a think. How are you currently measuring success? What are you doing? Are you currently evaluating success, just by measuring completion rates? If so, you're not alone. That is, it is common practice, but what we're just, as I said, gently advocating for is to move towards evaluating meaningful outcomes. So what we're seeing is actually thinking about, was there a change in practice? Has a quality outcome changed? Have we seen a reduction in particular risk or workplace injury? Have we seen a change in care? This is what we know high-performing organizations are doing. So we're moving from just measuring compliance and completions of learning to evaluating if a change in practice or an improvement to one of those outcomes is seen as a result of someone or a cohort of learners, a cohort of staff, or your workplace undertaking that training and education. So that it all starts in your needs assessment. When we're in this planning phase and we're setting learning outcomes, it's also worth considering, how will we know if it's effective? At the end of this cycle, at the end of this mandatory training plan, how will we be able to communicate that this was the value that it brought? What did we achieve as a team? So I know it can seem a little bit overwhelming, to think, well, how would I do this? How am I going to evaluate changes in 1,000, 5,000, 22,000 staff? It is a daunting task, but encourage you to look at a framework. What you can see here is a really simple method of training and education evaluation, the Kirkpatrick model. Simple. You've got 4 levels. Level 1 in the pink is the lowest level of evaluation, because what that only measures is reaction. Think, yeah, it was good. How many comments do you see left on an item? It was good. Yeah, great. Thanks. Or, I liked it. That's level 1. That's the lowest evaluation level. Level 2 moves up a little bit. Completion, yes, I've done it. So that's where we're sitting here. But moving up, we can actually measure behavior. I intend to apply what I learned in practice, but the holy grail is looking at the impact or the results. There was actually a sustained reduction in falls as a result of undertaking a particular training. So let's aspire over time to gradually increase the level of evaluation that we're undertaking. So, looking at these activities, the checklist, get clear on your compliance requirements. This is what we're going to do in the next webinar on improving compliance, and in that manager workshop I mentioned. Maybe set a compliance rate if you haven't already got one, a KPI for your team or for your organization. Monitor it closely. You'll have a frequency, a cadence to the reporting. It's often monthly, but look at how you're setting yourself up for the year for that reporting and evaluation success. Thinking really, simply, how do we get there? Keep it simple. Not all training activities need to be evaluated at that highest level, level 4. Take small steps. Just pick one activity, one program, something you're doing. I'm talking beyond mandatory training, perhaps, but what program, what initiative are you running? And how could you identify what level of data, best evaluates the effort that you're going to with that particular program? Conserve your effort. Align the training program or the initiative's effort, the duration of cost with the evaluation method. Donna mentioned 1.2 million. 1.2 million is a lot of money. That was probably 4 or 5 years ago as well, spent on training. What's an appropriate method though to measure that return on costs? Is a level 1 or level 2, yeah, we learned something, is that enough to justify that $1.2 million spent? Some food for thought, but even just set a goal. Start small. If you're not currently measuring beyond that level 1 data, maybe consider setting a goal this year to, on just one instance, collect an instance of level 2 data in the next year or next 6 months. So some practical tips. this is where we're going. This is the direction that we're moving to. Our desired state or our goal is to be able to prove, show, and demonstrate the learning outcomes of mandatory training, and in fact, all training. So we have a pilot program at the moment that's looking at building competency assessments into our platform, and we're considering how might we be able to integrate this into a mandatory training plan. So pre, post, throughout a module, what is the way that we can build software and an educational product to help understand and be able to demonstrate the desired learning outcome. So reach out if you're interested in joining the pilot program. It's pretty exciting stuff. Alrighty, now for some fun. Serious fun though, I might add. As you can tell, Michelle and I, we try and think deeply, I would say, about mandatory training. We know it's needed. We know it's not going anywhere, but how can we challenge some of the thinking? So last little section for us today, we've been out busting some myths, haven't we, Michelle, about mandatory training? There's 5 of them.
Always.
And we are going to try and just plant some little seeds about how we might be able to do things a little bit differently. So myth 1. Completion rates are the desired result of mandatory training. The myth is busted. I should have added a little animation of us jumping out of the bushes. Busted. We need to be able to report accurately on completion rates. That's fundamental, but focus on the outcomes. Focus on, how can we put just one metric even relating to clinical care, to workplace safety, to risk, a quality indicator. How can we assign just one metric at least to a mandatory training program or plan and link the learning to this? And just a reminder that your learning objectives for mandatory training and the topics that you're including really should focus on that compliance. So knowing the legislation, the standards, the regulation, risk mitigation, think workplace safety, and providing quality person-centered care. If your topic is way out of here, just think carefully about if it's needed, if it's mandatory, make sure you've got data to validate the need for that item. Myth 2. Mandatory training means someone is competent. Does it? No. Busted. Completing mandatory training doesn't necessarily equate to competency. So a practical skills assessment may accompany online mandatory training to verify competency. So you might have a practical assessment of hand washing, manual handling, basic life support, even fire safety. It might accompany it, but competency assessments and mandatory training, they're separate. They may be used together either before, like what I've mentioned, to verify existing competency, or after to confirm that competency acquisition, but they are separate. So mandatory training completion doesn't necessarily mean someone is competent in that particular area. So, core mandatory training topics may be designed with a competency-based education element and include verification, and then we could be have more assurance that someone is competent in that area. But just completion alone doesn't necessarily mean competence. Myth 3, a high compliance rate.
Just go back a slide, Zoe. I mean, I have done my manual handling competency and modules, and I would never be naturally in that position. I would bend my knees straight back, just saying.
And so it doesn't look very ergonomic, does it?
Terrible. Sore back, workers' comp, that's it. I'm out.
I think you're so captivated by whatever little nugget you've found on the ground, Michelle, that you've forgotten all the knowledge, all the skill, all the theory about manual handling, and you're just focused on getting that nugget. So, also busted. Nick, I think we really need that big busted sign on these ones. But education alone, no matter how much you've done of it, no matter, how and when people have completed it, it's not alone going to help you pass an audit. Because education, and I stand on behalf of AusMed, an education organisation, but education isn't going to solve every problem. Education isn't always the answer. So education, including mandatory training or especially mandatory training, think of it as one pillar of your organization's, overall framework or governance framework. If education isn't needed, or if it was designed to solve the wrong gap, we've got an issue, but that stems from an outdated policy or procedure or a lack of resources or staffing. Addressing that issue with education is not going to fix the problem. What we do want to see, to not just pass audits, but achieve what we want to achieve within a healthcare organisation is strong leadership, clinical leadership, clinical excellence, a positive learning culture, by not spraying and praying, by not saying that these 20, 30, 40 items are mandatory and we need them done by next week. That isn't going to create a positive learning culture. We want good systems. We want to support and enable our high performance teams. We want to look at the care environment and make sure that we've got all our ducks lined up. This is what is passing, what will pass an audit. Mandatory training alone is not going to get and help us achieve all the things that we want to achieve within our organisations. 2 more myths to go. The quality of mandatory training doesn't matter because staff are going to skip through it anyway. Oh my gosh, I said it. Busted. We know the types of behaviour that can be associated with mandatory training, but that doesn't mean that we don't need quality modules. Good quality design and integrity theoretically might encourage better engagement and achievement of the desired learning outcome. And regardless, it's critical. We want to create that good culture of learning. We want to reduce, if possible, that resource wastage. So if time is spent learning, let's try and make it worthwhile. Let's try and engage with education that helps us support staff to achieve those desired learning outcomes. And final myth, all organisational training and learning must be mandatory. Absolutely not. We know mandatory training, compulsory induction training, it has its place, but know its role, know how to use it wisely, monitor the effectiveness. Don't spray and pray. That's a Donna Wright, spraying out education everywhere and praying, crossing our fingers and hoping it makes a difference. Identify the need, validate it with data, plan and schedule it effectively.
Just a quick question to relate. I'm new in the role here and new at Hurston Private. Let's take mandatory training for manual handling as a real basic. Previously, I was trained as a train the trainer. For an organisation of this level, or is there a legal requirement for me to have certain qualifications to be able to then pass on certification for others in any capacity? Or
do you want to take that one, Zoe?
I reckon you might be able to. I'm just thinking.
Yeah, there's no legal requirement in terms of legislation. The industry practice is that people that are assessing competence or training physical behaviours will probably have a workplace training and assessment certificate. So I just posted in the chat, and someone will be able to correct me, but it's a TAE 4011, and I can't remember what number we're up to. That is the preference around competency assessments, but no legislation on it, just best practice. I haven't seen many people get undone, but it is best practice in terms of.
I've done a postgrad in education, but it was more
stuff. Diplomas and masters and grad dips trump cert for.
Yeah, so just for example, manual handling. Previously, for the whole lifetime ago, I did pre-hospital emergency care, so I had to do a level 4 to be able to teach level 3. Do I have to potentially do an ASL to an ALS to be able to teach basic life support, or there's nothing really that states like what level of qualification you need to be able to teach the one below? Or I think when you start getting a bit specific, it gets a bit picky. So ALS, I wouldn't be teaching that unless you were certified. Absolutely. They will check quals around that space. But as above height, so I could do basic life support now?
I mean, if someone else has an opinion on this in the acute care space, go
Yeah.
for it. I think ALS is super,
Be very
super
careful.
risky.
Yeah, and
And-
ALS 100%, not even
Angie?
looking at that just yet. But for example, we had just basic life support, which is something that I really need to jump on immediately. So I am happy to sign off based on my level of skill and ability in my previous practice to know within my scope of practice that I could be comfortable signing off basic life support.
But you being comfortable versus a regulator or an auditor deciding that they're comfortable that you have currency and recency of qualification to teach the current practice would be where your risk is. So you need to weigh up your capability and sense of competence versus what the auditor is going to value it in an acute care setting. And I suspect that's probably a slightly riskier move.
For basic life support, is that okay though?
No,
I would check. Yeah.
I wouldn't touch that one either. I'm sorry.
I direct any questions about this where we have experience, but we're not the authority. I think the Australian Resuscitation Council, the ARC, is the best place to at least have a discussion about that. They're a great organisation, and
would that be equivalent to the manual handling then? And is there an organisation that would?
No, manual handling. No, manual handling is different. It doesn't have a certification around it. People do still prefer physios to teach it, but it is less regulated and less risk. Okay. Sorry, Angie and Daniel, if you're trying,
perfect. I'll be quiet now.
No. I'm worried that they don't have a question. I'm worried that they wanted to input into the conversation. So I'm inviting them to input into the conversation if that's what they wanted to do. Daniel or Angie?
Yeah, no, definitely. Sorry, can you hear me?
I've got my earbud.
Yeah. So well said. With manual handling, though, I think it's always not necessarily just the qual. Like, say you went and did your BLS with an organization. If you don't practice it on a daily basis, I don't think you're probably the best candidate to be delivering that training. So there's always that side of it, because then there's that sort of question around, do I know best practice? Have I been involved in practice? So with manual handling, exactly what Michelle ended her sentence with, it's normally physiotherapists that are the best candidates to deliver that kind of training. I don't think there should be an expectation by any employer for a registered nurse, say, for instance, or someone who's a nurse educator, to particularly take on that sort of responsibility. But I think ARC is best for BLS and ALS, like Zoe said. But I think with manual handling, it's rather just like the industry, if you like, and just if you want to benchmark and check in with other very similar providers like your service provider, just to see what they're doing, that would really help much. But I don't think there's a lot of legislation in that space, other than you have the quals and you've got the experience and you've done it, so you have a good understanding of best practice when you're delivering and monitoring.
Thanks,
that's just
Daniel.
my 2 cents.
No, that's helpful. And Rebecca has posted in the chat, it's legislated per state. I guess I will just draw people's attention to sometimes the lack of clarity in the legislation. So as an example, in New South Wales, we talk about first aid certificates in aged care facilities. And the concept is that you should have someone with a first aid certificate on every shift, at least one across your facility. However, an RN's qualifications trump a first aid certificate. So then if you have an RN on every shift, then you don't need to worry about a first aider on every shift. But the legislation itself, it doesn't say unless they're an RN, but that has been tested and RNs do supersede that first aid. So it's so frustrating in terms of the lack of clarity and specificity. I do think with ALS or BLS, you probably, it's another level. Zoe, sorry. And she hasn't spoken up, so I'm just going to leave that one there. Oh, she's off mute now.
Ask away.
All good. Thank you. I just I just wanted to add what Daniel said. That was basically what I wanted to say. But just because you said there was an urgency in BLS, I can just let you know from my experience that when I was an educator for one of the largest hospitals in ACT, I did teach BLS, but I'm a critical care trained nurse before in aged care. And we had an accreditation and there were no issues. But there is the trainer for BLS and for first aid, and basic life support. If you do that course, then you'll be safer, because I did that course as well, which is provided by a lot of private educators. So yeah, that's all. Thank you.
Brilliant. Thanks, Angie. And thanks for the comments in the chat, particularly yours, Andrea. I love hearing about knowledge decay. I think a couple of comments I was just reading, not using it, we're going to lose it. And just those small but meaningful ways to link learning to an outcome. What we're advocating for is we don't need to move mountains. We don't have to reorganize the whole way that we're doing things, but start small. Take those small steps to look at linking learning to a meaningful outcome, documenting that change, and using that to demonstrate how you as a team and your organization, is working together to improve outcomes. So unless there's anything more from you, Michelle, I'll leave this slide on the screen. If you haven't done so, this is the second of 4 free webinars in the series. We look forward to seeing you at the next couple, where we're going to look at improving compliance and then finish with building workforce capability just before the end of the year. So thank you all very much for coming. We'll send the slides and recording plus a PDF to the digital mandatory training guide out within the next 24 hours. Thanks for joining us, and look forward to seeing you at the next webinar and the next mandatory, not mandatory, oh my gosh, the next manager workshop that Michelle's running. But it's mandatory. It's mandatory for the managers.
I'm not going to pay you to be there.
It's optional, I should say, but highly recommended, suggested. Thanks, everyone. Happy Tuesday. Bye-bye.